safety comes first, and for the patient and the people that are performing x-rays, because of the amount of radiation that is exposed. I mean, radiation is a dangerous thing. You can't see it, you can't smell it. It's just, it is being permitted out as we're taking x-rays. So precautionary things that we take, first are our badges, the dosimetry badges. These are little devices that monitor the amount of radiation we're exposed to while the staff members are exposed to while we're taking the x-rays of the patients. See, ours is on every 3 months. We get new badges, we send in the old badges, and they do a report on how much radiation we're exposed to. So really, in our clinic, it's a small clinic. It's only me and Dr. Zamzo. We're the only 2 badges that there are, and this is our report from it, and it gives us our current year to date, and then the lifetime of the badges, our readings. So we just kind of go off of the back for the type of badges that we have. You know, ours is measured at deep dose, lens, which is the eyes, and then shallow dose, you know, your external extremities. So ours is showing us that things are good. We're not over the maximum dose, and then mine is below it. So it's showing that our machine is not spitting out too much radiation or too much scatter radiation, you know, that is bounced off of the table or the client. So when it's time to take the x-ray, we have our thyroid badges, thyroid collars. That's mine and Dr. Zamzo's. And then we have our lead aprons hanging up. You know, we don't want them to be bent or folded, nothing to damage. How long we go? So we want to examine our lead aprons before we put them on to make sure that there's nothing obvious that might be of concern, you know, when we're taking our x-ray, that might be harmful for us. So I don't see, other than it being a little dirty, there's no rips, there's no damage to my lead apron. And we x-ray our own aprons once a year to make sure that nothing is there that needs to be addressed or replaced, or any damage to the aprons. So it's just kind of how we put on the aprons. They're big strings and they're kind of heavy, so there's that. Take the thyroid collar. You want to cover everything that we possibly can. It goes on here. And then my dosimetry badge, it should be worn at the thyroid level. It's exposed, should be out here to where it's reading whatever's happening with this x-ray machine. So then, as we move on, after we're prepared, we also have lead gloves, if at all possible, that we have to use. It's not recommended because it still doesn't protect us fully from the primary x-ray beam. Our x-ray machine has this nice long our button to take the picture that allows us to position our patients, and we can get far away across the room from our x-ray machine. We can even leave the room and close the door and still be able to be protected from the beam. So taking all the precautions necessary for us and the patient, because they're being exposed to x-ray too. So doing it right the first go around, setting them up right the first go around in one picture. If you can get it right, that's all the amount of x-ray or the radiation that needs to be done. Other than the people who are taking the x-rays, or should be the only ones in or around the machine, out of the room if you're not, it does damage to the cells, the reproductive system. So a pregnant person should never be around any of the x-ray stuff. It can damage the fetus. It can damage reproduction of young people under the age of 18, or just anybody young should never be involved in doing the x-rays. So that's what it is. It's safety first for all of us and the patients involved. So we're going to position our patient here. This is Bentley. We already have him anesthetized to be able to take the best film that we can, you know, without any movement or anything. We're going to take his radius and ulna shot. So we had him covered up to keep him warm since he was knocked out. This is the cassettes that we use. It is the smallest that we have to take this film. I'm going to get him positioned. So I'm going to put him in ventral recumbency, which means he is on his chest. Okay. Now I'm going to use gauze as a rope to kind of pull his leg forward because I want it as straight forward as I can get it. So I'm going to tie it on him. Got a lot of hair. I'm going to tie his leg straight forward, and I'm actually going to tie it to the table. This way, by the time I have him secure where I want him, I can take my film safely away from him. But he'll be in position that I want him in. So he's tied to the table. Then I'm actually going to take a piece of tape and rotate his leg the way that I want it. You know, he's pulled straight forward so his leg stays straight. But then I'm also going to secure it to where it's where I want it to stay, without me having to touch him or any of the staff touching him during the x-ray. Okay, so now that I have him secure where I want him, then we're going to collimate. There we go. I'm going to do the collimation to where his the primary beam that's going to be taking the shot, I have it. I'm going to adjust it to where it's going to be just distal to his carpus, and then proximal to his elbow, which means that I'm getting both joints, you know, in the picture along with the actual radial and ulna. And then I'm just going to square it in as close as possible without too much other radiation going on. And then I'm going to take my label here and I'm going to place it to where it shows that it's on his his left side that we're taking the picture of. Here's my label. I'm going to set it next to him. And then that way he is secure in place and ready to take this x-ray shot with me or nobody else very close to him. Okay, we're going to take the VD image of a feline here who's already anesthetized. He's laying in dorsal recumbency, which means on his back. Sternum is up towards the air. I'm using a sandbag and a rice bag to help hold him in place. We don't have a V-trough. That's another tool that could be used, or even a foam wedge is one thing we can use. So I want him on his back. I want his sternum in line with the spine the best that I can. So, and I want his legs, his paws all the way forward. I'm going to turn on my light here so I know that I'm getting him kind of in the area I want him for collimation before I tie him in place. To have him collimated, I want him between the thoracic inlet and about the first vertebra spine. You know, I want the whole chest in there. I'm going to have the center right over his sternum here, along with his scapulas. And then the outside collimation is just right along the body of his, you know, of his body, the wall of his body. So I'm going to tie his feet forward just to hold him in place for me. I've already got one in place just to get it started. That way when I take my image, I'm not going to be anywhere near him, but he'll be in the position that I need him in. His back legs are all the way stretched out, so I've got a good straight cat here in line. I can tell that my crosshairs for collimation is where I want it to be. I've got my marker here ready to go. I'm going to use my caliper to measure on the thickest area of him. So he's about a 7. So I'm going to go to my machine here. He's in the 5 to 10 range, so I'm going to choose that. Our machine already gives us the numbers. So I'm going to go to the x-ray machine and I'm going to adjust them. 2, 154. Okay, then I am ready to step away from him and take my image. And I want to wait to take the image as he's taking an in, as he's breathing in. And in. And that is how we take a BD image. Now we're ready to take the actual film, the actual x-ray of the radius and ulna. So I'm going to use my calipers here, and I'm going to measure at the thickest part, which just happens to be like the midline of his arm here, or of his leg here. So I'm going to put the calipers in. I'm going to read my centimeter side. So he's right about almost a 2 centimeters is what we're measuring at. And thankfully for our machine here, we have options that helps figure out our numbers are. So here's the 0 to 5 centimeters, which he'll be in. So it gives me 60 and 2.34. So I'm going to take these numbers and I get to plug them into our actual x-ray machine. So here's our kilovolts, which was 60. And this one, you got to get it as close. The numbers are pre-programmed into our machine here. But once I have it there, and I'm ready to take my shot. I've got my label, he's secure, I've measured everything. So then I'm able to take my clicker here. I've collimated and I've centered, and I'm going to get as far away from Bentley as possible. Gotta let my machine warm up and ready to take the shot. It's done beeping, it's ready to take it. And there's my film. Thanks to digital today and computer technology, our patient that we're taking the x-ray of, he's already in the system. He's a patient of ours, but I'm going to show you how through our computer system that we can request the images that we want to take of him. So I just go to our patient clipboard in here. I search for my patient through the owner's name. And then here's Bentley. He's my patient that I'm taking my x-ray of. So I want to request an image. Radiograph to view. And even through here I can select what shots I'm wanting to take of him. So I know that I'm doing a left front extremity. I'm going to choose that option, and then I have all my different options, but I'm taking a shot of his left radius and ulna. That's what we're taking our shot of. So I'm going to choose that one. I hit OK. And the computers talk. So then it is sent over. It always takes a minute to get across to our digital x-ray system. So here's Bentley. He just popped up. And here it is. It's showing that I'm taking a radiograph of his radius and ulna. Thanks to digital technology, retrieving a patient's image is easier than it used to be. I mean, of course, filing the old paper images is a way to do it, but we have the digital system, so there's a couple of different ways I can pull up someone's images. we've got the options of images taken this week, last week. I can choose a date range of when I'm looking for, or I can just simply search for the patient name. So one of my most recent ones would be, let's see, what was his name? Bentley. I'm going to search Bentley. Here is all his images that were taken. There we go. There's skulls, rear extremities, all my dates of when we took what images of him. So this is just one way that we can retrieve past images of a patient. Okay, to do a radiology log, to actually keep up with the log, all it's showing is what date we took an image, who the patient is, the views that were taken, what KVPs and MASs that we were shooting at. So for example, say we did Bentley, who I like to use, on February 1st of 2018. His name is Bentley. Can't think of his last name. We did a cranial, caudal, radius, and ulna shot on him. And then just per what he calibrated at, calibrated at, he was shot at 60 KVPs, 2.42 MASs. I was the tech. I'm putting my initials on there. So this is just simply trying to keep up, if we didn't have the digital system, or if the digital system broke down on us, a way to keep up with who we shot, when it was done. So, and being that we don't have the traditional X-ray unit anymore, we have our digital. Everything is stored electronically. So if it's not on our digital imaging system, it's already into their patient file. But say the X-ray machine went down and we had to go back to the old days, which I have used before we got our digital system. It's when you do your X-rays and you actually have your film, and then we have to label the film, and they were filed away in paper files. We just don't have any of it anymore to show you. But then I would have this information of what shots and stuff that we did to be able to put into their medical file. So I'll show you how that would be done. So I would just pick my patient. Not right here. So our system, like we have our medical notes, I would pick a patient, whoever I'm putting my information in. So if I just wanted to add this type of information to show that what X-rays were done and what they were shot at, we've got a place called default comments where we can just type in whatever we wanted to. And here is where I would be able to type in any of this information, what shots we took, what levels he was shot at, and what results we found. That's a way to do it if we didn't have digital system anymore. So we're going to do a GI contrast study on gun. We would start with taking like a pre-film just to see what we're working with before we administer anything to him. We're going to use BIPs. It's the barium impregnated polyethylene spheres. The spheres are going to be what we're looking for as it travels through or not through the digestive tract. So for a small dog like Gun here, he's going to get all 4 of these capsules. So what we're looking for with this study is if he was a dog that was to have eaten all kinds of his toys. We're looking for possible obstructions, or we're looking for mobility issues in the GI tract. And doing the BIPs is going to tell us this. So we're going to, oh, no, go ahead. Let's get good. So continuing on, got 2 to go. So after we have administered these, we're just going to let him go and hang out and rest, and then we're going to wait about 6 hours or so and take another film to see where in the tract our spheres, our VIPs, have made it to, so we'll know whether there's a blockage or if things are not working. Okay, now that we are about 6 hours into giving Gunn his barium earlier, we're going to take a film now of his abdomen to get all of his intestines, his colon and stuff, to see exactly where the barium is at this point. We're hoping that it's in his colon. That means that there's no obstruction and it's moving along its way. So we've already measured him. I've already plugged in my numbers for my KV and my MAS. And then we're going to take our shot and see what we have. Going. Okay, we are doing the OFA VD of Bailey, our anesthetized dog here. It's at her pelvis. She's being propped up by a foam pad. So I'm taking her hind limbs. This is how we're going to put her into position to get this film. I need to rotate them medially in together, have everything as straight and aligned as possible. I'm trying to get her patellas in line over her trochlear groove. I have to make notes to remember the words. And then we're going to tape her into place and then collimate her into place. So I'm going to have help getting her taped into place before we take our view. Okay. Once we have Bailey's taped into place, then we can position her better and over where we're going to be collimating to take our film. I have help holding her in place. Okay. Here is my area of collimation, so I need her to come this way some. Got her as straight as I can see that is possible. I have her tail best I can align with her spine. Let's see, so she needs to be, for collimation, I'm using notes to remember where to go, cranial to the crest of the ilium. So she needs to be, here is about the crest of our ilium, so our collimation is cranial to it. Let's see. Lateral to the greater trochanter. So it's going to be past, oh, that's right. That's for that. That's the outside of the hips. So just to the outside of her hips. And then distal to the patellas. It's below her patellas here is where we have it collimated right now. So I'm going to put a nice heavy sandbag to hold her into place here. Oh, and then I need to. Then you measure on the greatest area of the pelvis. We're about 12 and a half, 12, 13. Go to my machine. She's in the 10 to 15 range. 74, 2, 4. I'm going off of the machine or off of our systems readings to take the film. Now we're ready to step back and take this film of Bailey.